I wanted to get your thoughts on the idea of passing legislation in New York State that Governor Cuomo is proposing called the Reproductive Health Act. The Reproductive Health Act does a lot of things, but there's a couple things that I want to get your input on, and they have to do with making abortion procedures and contraception fundamental human rights. What, in your mind, does that have? How is that going to impact medicine?
The Reproductive Health Act is very disrespectful to the practice of medicine, as well as being disrespectful to the women's health that it is proposed to protect. It is disrespectful in the fact that when you make it a right, then you're saying that regardless of whether the pregnancy is planned or unplanned, that a woman should consider, first of all, terminating her pregnancy. That does two things. One, it puts her at odds to the very child that she has reproduced, and it disassociates her relationship with the person that is a product of her body, and also a person who is directly related to her. And so you're asking her to terminate a relationship that is very inmost a part of her. As far as it affecting the medical profession, it's disrespectful in that it doesn't consider the relationship that a woman has with her physician. So the sacredness or the privacy of that relationship is totally destroyed, and it destroys the conscience of the physician if he knows what abortion does to a woman, physically as well as mentally, emotionally, what it does to the product of the pregnancy. Then you are really asking him to go against the ethics as well as the medical profession that he has taken an oath to protect.
That's an incredibly powerful statement. I want to go back to that you took the notion of abortion as making abortion a fundamental right as kind of changing the very perspective of pregnancy. So instead of, it sounds like what you're saying is that the default position of viewing pregnancy is ending the life versus continuing through with the pregnancy, the default position.
The Reproductive Health Act essentially says that it is a woman's right to choose to end the life of her child. And so whether the pregnancy is planned or unplanned, you're saying she has a right to end it. Well, does that make it wrong or gives her that right if it's a wanted pregnancy? It makes no distinction. And even if it is an unplanned pregnancy, then you're saying that the woman has a responsibility to consider that as primary. And instead, the natural law says, this is my child, I have a right to protect it. So now you've got her at war. Do I protect or do I kill? And I think that is inherently providing a conflict for the woman that the government has no right to provide.
So let me ask you this about the delivery of medicine. When it comes to making contraception a fundamental right, that means that a minor can get access to contraception and surgical abortion without parental involvement. What's the relationship between, or what should be the relationship between the minor, the parent, and the physician? And what does this do to that relationship?
The relationship of contraception being a right, I believe, is misplaced because a minor should not be contemplating sexual activity at this point. So now you've changed the whole dynamic of what a teenager should be concentrating on, preparing for adulthood. It is a slippery slope to make a medical treatment into a human right because a medical treatment is supposed to treat a disease. pregnancy is not a disease. Pregnancy is the normal expected outcome of sexual activity. That's why I say, I ask you the question, why should you make contraception a right for a teenager when sexual activity, our culture should not be normalizing sexual activity for teens? And we should expect that when you become sexually active, pregnancy is a natural outcome because that is one of the purposes of sexual activity. So when we make contraception a right, then we are disconnecting sexual activity artificially from pregnancy. When we say contraception is a right, again, we're saying sexual activity without pregnancy is the norm. That's not appropriate. One of the purposes of sexual activity is reproduction. Otherwise, our race would not continue to survive. There is a disproportionate number of abortions in the Black community. In the United States, there are African Americans are 13% of the population, but we get 35 to 30% of the abortions. That is out of proportion to our population, and it's out of proportion to reproductive survival of a race. Any race that has a fertility rate that's greater than, in order to reproduce, a population has to have a fertility rate of 2.1. That allows for the reproduction of yourself and 0.1 to cover natural miscarriages. But when your fertility rate is less than 2, then you're not going to reproduce and you're not going to survive. With the abortion rate that high in the African American community, it is expected that we will eventually become less and less of the population and may become extinct. That is unconscionable when you consider that most of the abortions, the abortion clinics are in the Black minority communities, so it appears we're being targeted. And that concerns me. What concerns me even more in the African American community, that we now consider reproductive justice or a choice or a right to choose as though we have accepted the mantra of the community without understanding the devastating effect that that will have on us, not just as human beings, but also as a people.
Yeah. Oftentimes when something is declared a right, in time it is also declared a duty. What ramifications do you foresee making abortion a fundamental human right would have on the medical community and their ability to not provide or refer for abortions according to their own conscience?
If abortion becomes declared a right, then that's going to pit physicians and healthcare professionals who have accepted the oath of Hippocrates to first do no harm and to not provide for abortions. That's going to pit them at odds to providing safe health care. When you consider that abortion complications are real, that it's not just in the pregnancy and there are no results, there are known complications of mental health, of hemorrhage, of injury to internal organs. There are known complications of infection, known complications of death. A physician has a responsibility to try to prevent those things. And so now you're telling me I have to provide that? That is unconscionable, especially for our government to tell us. You're going to lose a lot of physicians who will get out of health care if that should occur. It's going to definitely affect the quality of health care because you may have others who will step in and provide that without the appropriate training. So I have serious concerns about not just individual physicians, but about health care in general if abortion becomes a right. One that I didn't mention earlier was the increased rate of prematurity that is associated with abortion, and the increased risk of maternal mortality. So the very woman you're trying to help, you are increasing her risk, and that is unconscionable.
This particular law would deregulate abortion by allowing non-physicians to perform them, lower-level medical providers. Is that good for women? Is that good for medical care?
I think there is a place for non-physicians in healthcare, obviously. But I have concerns about any time there is a complication or a problem, it's usually a physician who will provide care for the complication. So I have real concerns about the health and safety of the provisions if other than physicians are providing that care.
This bill actually totally dehumanizes the preborn boy or girl. How does this impact the ability of the physician to provide quality care for pregnant women?
We know it's a human because humans only reproduce humans. We know that from the moment that the sperm penetrates the egg, that fertilization or conception has occurred. If we did not know that, even without sonogram, that this is a human being, why then would we pay the money that we pay to in vitro fertilization doctors for reproductive assistance to get pregnant when the pregnancy is desired? So I think we're playing smoke and mirrors, or we're being unfair, untruthful to the science when we say that it is not a human, it's not a baby, and the woman has a right to end an unplanned pregnancy. We know it's a human being because humans only produce humans.
How is uncapping abortion to all 9 months of pregnancy good for women?
Uncapping abortion to all 9 months of pregnancy is good for no one. It is not good for the baby, obviously. It ends the baby's life. It's not good for the woman because she has felt the baby quickening. She's probably had a sonogram by then. She has seen it and she knows it. And so the regret, the remorse for the rest of her life will be there. And it's difficult to maintain your mental health and your ability to relate even to other people or to subsequent children that you may have when you know that you have deliberately killed another person. It's no wonder that our child abuse rate has gone up. Broken relationships within families have occurred in proportion to the numbers of abortions that have been carried out in America. The abortion rates not only hurt babies, but they hurt women, and it does not provide health for the women. It's not reproductive justice for a woman to end her child's life. It is injustice, both to her and the baby, as well as to her family and the community.
In some ways, what you're saying is it's an oppression for the next generation.
Absolutely. Just look at the evidence of what has happened in the black community since 1972. Roe v. Wade was legalized. Abortion is the leading cause of death in the African American community. Our community has been devastated by the separation between families. It is not good to have abortion as a right. I would like to say to the African American community in New York to learn from history. Let's not forget the lessons that we've learned from what has happened to genocide in other communities. The Holocaust and what happened to the Jewish community in Germany is something that the Jewish people won't let you forget. Because if we don't learn from the past, then we're destined for it to affect our present and to eliminate our future.
Yeah, and there seems to be a theme when it comes to genocidal stages in history. And that theme seems to revolve around personhood. where one group of people decides what qualifies as a person, and they, in so doing, enslave those other people.
We have accepted rights and choices as being superior to what is good for the whole. So individual rights are now being put before the collective. At this point, there will be no collective African American community if our abortion rates continue as they are. We must consider what is good for the whole as we consider what is good for us, ourselves as individuals. Well, I just think it's ludicrous that African Americans or any people would choose to participate with the government that is funding and providing as a right for you to kill yourself. I mean, that just is inconceivable to me that I would support that. We may be having difficulty with providing for our children. Why wouldn't we take the same money and resources that are being targeted toward killing us to make that provision for the very people who are products of our bodies, who are products of our relationships? I don't get it. I'm really surprised more doctors are not protesting this very reproductive health law. This is not health. This is death. And when you consider even that premature labor, infant mortality is increasing, and we talk about the infant mortality rates in the United States being higher than other developed countries, yet our abortion rates are higher, and we're not putting the correlation. We're dismissing the evidence-based research instead of learning from it and making laws and regulations that would help us have a healthier nation.
What kind of laws, as a doctor, what kind of laws do you think we should consider instead?
Well, for one, we could start by doing quality research in America on correlating abortion. We've got enough history on it for the last 40 years, and what really happens to the babies and what happens to the mothers. Instead, we have some states that have never reported their abortion rates or maternal mortality to the Center for Disease Control. We have several states that will tell you that they don't report that information, and the CDC has not required it. And so when we look at the number of abortions that are done and we compare it to what has actually happened to the woman's health, the numbers are incomplete. So it's really hard to say that abortion is safer than childbirth. You can't say that because we don't know how many abortions were actually done in America, nor do we have the comparison to childbirth in America or to abortion deaths in America. Our numbers are not evidence-based, yet we continue to say they are. Reality is, we do not know in America what the true outcome is, and it's being buried. Even the chemical abortion that are being done with RU-486 and with, they are not being recorded appropriately. And so we don't know what is actually happening statistically with evidence in America with abortion. And yet we keep saying we do. Truth is, we don't know.
Would you support any kinds of notions, any kind of laws that would encourage waiting periods for abortion or parental notification? Is there anything that we can do in terms of legislation that would increase the quality of care for women facing unplanned pregnancy rather than deregulate?
We could increase the quality of care in America, I believe, if we simply kept better statistics and if we learn from those statistics. And one of the first things I would say is let's limit rather than expand abortion services. Let's limit until we know exactly what is happening. And let's make correlation between even death certificates and cause of death. Right now, we know from studies that are done in other countries, there is an increased risk of death for women who have had multiple abortions, for women who have had abortions over women who have given birth. But we don't have those numbers in America because we don't keep those numbers. So that would be one thing. Let's get the evidence to support the decisions and not make any more regulations until we know what is happening in our country.
So you would say investigate before you regulate.
Investigate before you regulate. Sounds good to me.